Hi, this is Dr. Bharadwaj. I am CEO and homeopathy doctor at Fidicus Homeopathy. Today we will discuss about a case. The case is about sebaceous cyst. It is one of the common cysts that occurs in a human body. It is an infection on the skin where your skin becomes red, swollen, and it becomes hard. Okay, due to that you will have swelling, sometimes pus, and blood may come out of it. It is not life-threatening condition, but definitely it is very discomfortable to some of the patients. What happens in this disease is there is no permanent cure in allopathic treatment or Western medicine, English medicine, or when you go to a surgeon. What they will do is they will do IND and remove the cyst completely. Even then, the success rate for surgery is very low. It may reoccur again and it may develop at some other place. The tendency of forming the cyst is not removed. But coming to the homeopathy, there are three things you have to understand. First is we can cure that particular cyst completely without surgery. Next one is we can prevent that from occurring again and again. Third one is relief. Relief does not occur in this. When we say relief means there is no cure, but only sometimes we will symptoms are relieved. But this is not the case with homeopathy. Almost all the cases of sebaceous cyst or sebaceous abscess I have treated are completely cured. I can say the success rate in homeopathy is more than 99%. You can not only cure a particular cyst, you can prevent it from occurring in other place also at the same place. So such is the importance of homeopathy. Now I will take you through a journey of a patient, how he has come to us. Okay, I will show you the pictures, what happens in the middle, what happens in the end, and what he has to do next. Once the cyst is completely cured, it has opened, the skin has become normal. So what he has to do next so that it will not come again and again, or it will not come at another place. Let's dive deep into that particular case. Yeah, sebaceous cyst, patient cured. What next? We will see the patient, the journey of the patient, how it got cured, and what is next. Once it is cured, why you should not neglect it, and what you should do once it is cured is the important thing you have to know. Let's start from the basic. What is sebaceous cyst? Okay, you can see this is the structure of the skin. It will have three layers. Upper layer is epidermis, middle layer is dermis, and lower layer is hypodermis. You can see this is upper layer, this is a middle layer. We are not showing the bottommost layer. There is a special type of gland in this area. See, this is a hair shaft coming out of the hair bulb. Okay, you can see the muscle here, and this is the sebaceous gland. This gland normally opens into the hair follicle, or sometimes it can directly open onto the skin. Both are possible. This sebaceous gland is present on all the parts of the skin except on the lips. This gland is not present on the lips. What is the function of this gland? This gland secretes sebum, a oily like thing. Normally some people have more oily skin, right? Because this secretes more oil or more sebum. The secretions that is coming out from this gland is known as sebum. It secretes more sebum. There are a lot of important things because of that sebum. It will keep the skin moist, it will protect the skin from invading of microorganisms. There are a lot of things. It has antimicrobial properties. Lot of use we have that from sebum. So what happens when this get infected? We will look into it. You can see the duct gets blocked. So this is a sebaceous gland. You can see this is the duct that is coming out from here, and this get blocked. Once this get blocked, what happens is the sebum which is secreting will be stored inside. It will not come out. The oily thing on your skin will not come out, and this will get infected. This is known as sebaceous abscess, or normally it is known as sebaceous cyst. Okay, sebaceous infection. There are many names for it depending on the stage of the disease. We will not go deep into it. Okay, this is sebaceous cyst. Once the cyst get infected, we call it as abscess. Once the abscess is formed, what happens? Normally it happens in neck, face, and neck, face, trunk, and scalp. It happens in neck, it happens in face, it happens in the body, and it can also happen in the scalp. Large ones are painful. When this becomes infected, when this becomes large, it gets painful. You can swelling with a dot or hole on the dimple. Okay, you can see here there is a sebaceous cyst or sebaceous abscess. There is redness, there is swelling, and also you can see there is a small dot here. Okay, this is how you have to identify sebaceous abscess. And something is coming out that is cheesy, foul smelling, ruptures. When it ruptures, blood comes out, and pus also comes out. Normally the sebum becomes infected and it becomes foul. The sebum which is infected and it becomes thick and it comes out of this small hole. When this get infected, it becomes red, painful, and once it ruptures, once it opens, once this part opens, you will see blood and pus, and it will be very painful and discomfort for some people. Next, what is the conventional treatment? Conventional treatment means allopathic treatment, or Western medicine, or English medicine, or surgery, or when you go to a surgeon, or when you go to a corporate hospital, or when you go to a local doctor. All these known as conventional treatment or English medicine. The only option they have is surgery. What happens after the surgery? It will repeat. There is high chance that it will repeat again and again, and there is no removal of the tendency of the formation of sebaceous cyst. So now the cyst has occurred in scalp. Tomorrow it may occur on face. Next it may occur on neck. It may occur on trunk or any other place, or any other abscess may form. That is a formation of abscess tendency, abscess formation tendency. Okay, that cannot be removed with allopathic treatment. Okay, how homeopathy helps you? We will look into it. Homeopathy will first cure the disease completely. Wherever the sebaceous cyst or sebaceous abscess is there, it will cure completely. Next, what happens? It will prevent coming again and again. We will know how do we do that, how to prevent it. Not only the particular one, at other places, how do you prevent? And relief is not applicable in this, because the success rate for me with sebaceous cyst is more than 99%. I'm not saying I will just give relief, the cyst will be there, but cure is possible. That's the reason we are not thinking of relief. Everything is without single side effect. Without single side effect, you can completely treat sebaceous cyst effectively compared to Ayurveda, Unani, Siddha, Allopathy. You take anything, it will be cured completely more efficiently compared to any other system of medicine, and it is timely. It is not, it will take 1 year or 2 years. It will be quick. We will go into the case, and I will show you how quick it got resolved. Okay, this is how homeopathy treatment will help you. Next, go to the case. Sebaceous cyst case. He is a male, 60 years, having lot of other complaints. Okay, I don't want to reveal those complaints, not necessary. And he is having the sebaceous abscess for a very long time. The thing is, the cyst has become abscess. Abscess means once it get infected, once it get red, swollen, pus is coming out, blood is coming out. That's where we call as abscess. In that stage, in severe condition with painful condition, he is not able to wear his shirt or a t-shirt. In that condition, or he is not able to lean backward. In that case, he has come to me, and he is not able to sleep on the back. At that stage, he has come to me. We will now look how it looked. Okay, the treatment started on 25th Feb 2025. Okay, recently. What are the symptoms? He has redness. See, you can see entire part is red. Okay, compared to the other part, and there is swelling. You can see here is a large amount of swelling. Okay, this is a swelling. And pain. He experienced severe pain when it is not touched, or he just sit. Sebaceous cyst is not touching anywhere. He has severe pain. That is known as pain. Next one is tenderness. Tenderness means if you touch, the pain increases. That is known as tenderness. Even it was so tender that he is not able to wear his shirt, he is not able to lean backward, he is not able to lay on the backside. That painful it was. That is known as tenderness. Next one is pus and blood. You can see lot of pus, blood is coming from here. He always has to wear a bandage, and he has to change the bandage every day, or every 2 hours or 1 hour he has to change the bandage. His life was miserable. Okay, let's check. This is on 25th Feb 2025. What happened next? Let's see what happened on 26th March 2025. So we have started the treatment on 25th Feb 2025, and let's see what happened on 26th March 2025. No redness. You can see there is no redness here. No pain. Pain is completely gone. No pain. Okay. No tenderness. There is no tenderness. When you touch, it was painful. There is no pain. It has completely reduced. Now he is able to wear the shirt, t-shirt, whatever he wants. He can lie on the back and sleep. He can lie on the couch and relax. So tenderness is also completely gone. Next one is swelling reduced. Swelling is not completely gone, but it has reduced to the major extent. Next one is no pus and blood. You can see it is completely closed. When was this? This is within the month, 26th March 2025. Next, what happened? 10th June 2025. Okay, what happened? No redness, no pain, no tenderness, no swelling, no pus, no blood, only scar. See, everything is gone. You can see a small scar here. That's it. Within 3 months, it completely disappeared. Okay, that's quick homeopathy works. No surgery, no side effects, nothing. Now this is completely cured, right? What the patient has to do next after completely curing? So for any treatment in homeopathy, there will be two parts. One is cure, one is prevention. In first part, we will cure the disease. In next part, what we will do is we will try to use some intercurrent remedies or constitutional treatment. You need not to know deep into it. Is a protocol in homeopathy. You can say it's a protocol in homeopathy to prevent the disease from occurring again and again. If you execute that protocol from now, if there is high chance that it will not recur again and again. Not only in that place, if there is tendency to have a sebaceous cyst or any other abscess in any other part of the body, it will reduce. How many months you have to take the treatment? At least if you take 3 months of additional treatment or prevention treatment, we can ensure that it will not come again and again. It is not 100% sure that it will not come again and again. In most of the cases, it will not come. But I have seen in some of the cases, the patient reach me after 5 years or 10 years saying that, sir, you have treated me sebaceous cyst 10 years ago. Now it has come. It will come lately. Maybe the tendency is completely reduced. For most of the patient, it will not come again. For some of the patient, it will reoccur, but after a long time. So that is prevention. Next, what happens in this time? What happens is there is a scar, right? Scar also will be completely smoothened. We will give the treatment for scar also. There are special medicines in homeopathy to remove the scar. Maybe we cannot remove 100%. Maybe we can remove 90 to 95% of the scar as well. Not only curing, prevention also very important in homeopathy. That's the reason that patient has to take the treatment for 3 more months to ensure that it will not come again and again. That is the thing you have to take. We will give two types of consultation for sebaceous cyst. One is online and one is in person. If it is online, you can have a video call or audio call. You can show the cyst to us, or else you can share the pictures or video, whatever you have. You have any reports with you, you have done an ultrasound or any other blood reports, you can share it with us. If any other reports are required, you can get them done locally and share it to us after we advise you. Once your case is taken, we will ship the medicines to your doorsteps wherever you are in this world except to Pakistan. If you are in India, it will take 3 working days. If it is in US, it will take 4 working days. If it is any other country than India and US, it will take 5 working days for you to get the medicine. We have multiple branches. If you want to meet the doctors in person, you can come and check with your doctor, inquire about the nearest branch and take the treatment. How do you contact us? You can call or WhatsApp +917997101303, or you can reach us on www.fidicus.com. Why you need to consider Fidicus homeopathy, or what do you get at Fidicus homeopathy? There are three important things. One is the doctors, the treatment, and the infrastructure we have. Coming to the doctors, our doctors are passionate, highly qualified, knowledgeable, experienced, competent, and compassionate. So you are going to get these type of doctors. And coming to the treatment, we use high quality treatment and best in segment. Which are the medicines are best in that particular segment? We get that medicine from wherever, whichever pharmaceutical companies. We get medicine from best pharmaceutical companies. Our medicines are of high quality. Next, coming to infrastructure, we have latest technology that is used at Fidicus Homeopathy. And Fidicus Homeopathy is the first homeopathic clinic and only homeopathic clinic that uses artificial intelligence in treating a patient. So that's the reason we have the highest success rate. Why Fidicus Homeopathy? You have many other clinics, right? You have a lot of doctors, you have a lot of corporate hospitals, homeopathy. Why Fidicus Homeopathy? At Fidicus Homeopathy, you have the highest chance of health. And for sebaceous cyst or sebaceous abscess, you have the highest success rate at Fidicus homeopathy. And coming to the next one, transparent treatment. We give you transparent treatment. What I mean by transparent treatment is whatever the current information available on sebaceous cyst will be completely given to you. Based on that, you can decide whether you want to take the treatment with us or not. But we will give you black and white information, whether you may like it or you may not like it. You will get all the information. And the next one is personal care. At Fidicus Homeopathy, we will have personal care. We use technology at the back end, AI at the back end, not with the patient. Whatever we deal with the patients is completely human. We will not put you onto some recording for that, press 1 for this, press 2. So you will be recognized by our doctors, recognized by our staff, and you will be given personal care at Fidicus Homeopathy. That's the reason consider Fidicus Homeopathy if you or your loved ones is suffering with sebaceous cyst. Now you have seen how sebaceous cyst can be completely cured in homeopathy without any surgery. Okay. If you have any questions regarding the sebaceous cyst, put it in the comments. If your loved ones or anyone having sebaceous cyst, you can share that video. Thank you.